Hi, everybody. Welcome to our first ever um, Ecg Basics session. So I'm going to try and keep my videos a bit shorter this time. As you can see, it's labeled Ecg Basics 1, simply because there's going to be quite a series of these, before we get to the hardcore stuff, before we get to cases, ECG case studies, okay? So without wasting any time, let's have a look at the ECG grid. When you look at this beautiful piece of paper with the pink lines, I think that's pink. There's certain things that you need to know, of course, certain components of this piece of paper. Now, forget the waves and whatever for now. What I need to highlight to you is that when you look at the x-axis, so going across, we are looking at time. We are looking at intervals. Remember that all events that occur during the cardiac cycle, they all happen in sequence, so they are timed. And so all of these electrical events or electrical activities that are occurring in the heart are then reflected as these waves on your ECG grid, right? And therefore there are certain, durations, certain segments that we need to measure in order for us to determine what's normal and what's pathological. Okay, so going across, we're looking at intervals, and then on the y-axis going upwards, we are looking at the size now of these waves and deflections. And we look at that in terms of millivolts, okay? But we will cover that later on. So which means that there are certain cut-offs for these waves. If they are bigger than a certain number, you get certain pathologies, okay? All you need to remember is that going up, we're measuring size, going across, we're measuring time. Now, you can see also that we have these little blocks on the side here. All that is the sort of the calibration, but I'll discuss that in a few seconds. And you can see that we have these squares here, and obviously these squares have even smaller squares inside them. Now that is what I want to focus on for this talk. Now let's zoom in on one big square. Okay, so this square is this one zoomed in. So one big square, as you can see, is made up of smaller squares. So 5 going across and 5 going up. And there are certain values that I want you to memorize, okay? Because you're going to be applying all of that knowledge quite a lot on the subsequent presentations. So one big box going across, remember going across, we are measuring time, we're measuring intervals. So one big box equals 200 milliseconds, or 0.2 seconds. So based on this, you can even determine how long each small box will take. So if you just take 200 divided by all these 5 smaller boxes, you'll find that each smaller box will then be 40 milliseconds, okay, going across. Now, please remember these numbers, okay? You're gonna need them. Now, in terms of dimension, okay, going across, one big box equals 5 millimeters, okay? You're gonna need that number as well. And obviously, if you do your maths, so one big box is 5 millimeters and it's made up of 5 smaller boxes. So 5 divided by 5 gives you 1. Therefore, each smaller box equals 1 millimeter. All right. Now, looking at, excuse me, looking at our height or amplitude or size. Going up, remember we're measuring the amplitude of the waves now. So we use millivolts. So one big box equals 0.5 millivolts. And we know that this big box is made up of other smaller boxes inside. And there's 5 of them, which then means each smaller box going up equals 0.1 millivolts. I mean, this is quite straightforward, right? And then in terms of dimension, the height of this big box is also 5 millimeters. So this is a 5 millimeter by 5 millimeter big box. And same thing with the smaller box, it's 1 millimeter by 1 millimeter. As simple as that, all right? So all these numbers that you are seeing here, memorize them, memorize them, memorize them, please. Okay, now looking at these blocks, so this is simply your standardization or your calibration, your normalization, whatever you want to call it. Now, the standard calibration of your ECG machines is that this needs to be 2 big boxes high, okay? Now we know, as we just said now, that 1 big box equals 0.5 millivolts, okay? Which means that 2 big boxes will be 0.5 times 2, which is 1. So your ECG standardization should be 1 millivolt going up. And also we know in terms of height that 1 big box equals 5 millimeters. Therefore, 2 big boxes will be 5 millimeters times 2, which is 10 millimeters. So 1 millivolt equals 10 millimeters. And going across, your normal ECG calibration should be 1 big box. And we know that 1 big box equals 200 milliseconds or 0.2 seconds. All right. Yeah. So that's the normal calibration of your ECG machine. Now, when this is too high, it's going to make your waves or your deflections also too high, and you can think that you can be misled that there's pathologies where there aren't any. And obviously, if it's too small, your waves are also going to be very small. So it's important to always double check that this is 2 big boxes high, and then 1 big box going across. Now, since we have now determined the normal, since we've determined how big each box is, we'll be able to determine the normal values now for our the different intervals, the different segments and stuff. So the waves that you are seeing here obviously represent what is happening in the cardiac cycle, where the P wave simply represents atrial depolarization, QRS complex ventricular depolarization, and your T wave ventricular repolarization. And I'm sure that's something that you already know. Now, using these boxes now, we are able to determine certain intervals. So when you look at the beginning of your P wave to the beginning of your QRS complex, you have a PR interval, okay? Now, we know that 1 small box equals 40 milliseconds. And so when you count up your boxes, you'll see you have 1, 2, and 3. I know this is a little bit out, but I just wanted to use whole numbers, you know, for teaching purposes. So you have 3 40 millisecond boxes that constitute your PR interval in this case. So your PR interval is 120 milliseconds, which is normal because your PR interval is 120 to 200 milliseconds. Okay. And then next thing you look at your QRS duration. So that, and from the Q wave all the way to the end of the S wave, and do the same thing, 1, 2 boxes. So 40 gives you 80 milliseconds, which is the normal duration because it should be about 80 milliseconds to 120 milliseconds. That's also a bit debatable. Some will go 110 milliseconds, some go 120, some even as low as 100. So let's stick to 80 to 120 milliseconds, okay? And I think that's what most textbooks would tell you. And then the next thing, you look at your ST segment, basically from your S wave to the beginning of the T wave. Here, we don't really measure anything, but I just wanted to highlight to you that what you need to look for is that your ST segment should be in line with your baseline, okay? So basically, you don't want an ST segment that is elevated, and you don't want an ST segment that is depressed, okay? It should be in line with your baseline, right? And then the next thing is looking at your QT interval. So you do the same thing, count the blocks. If you know how to count, you'll be good with ECGs. Okay, that's just, yeah, okay. Same thing. So you just add up everything, and then you get your QT interval. Now, when it comes to the QT interval, there's a concept of corrected QT interval, or your QTC. So the way you calculate it is you look at your RR interval. So from your R wave to the next, and then you count up the blocks that are in between, okay, from the one R wave to the next, and then you get your RR interval. And now that you've determined your RR interval and your QT interval, you'll be able to calculate your QTC by using this formula. So you take your QT interval in milliseconds, divide that by the square root of your RR interval in seconds. And then that's going to give you a corrected QT interval. And these are your normal values. So your QTC is prolonged if it's more than 440 milliseconds for males, and then more than 460 milliseconds for females. And it's quite abnormally short if it's less than 350 milliseconds. And just as a side note, there is that if it's more than 500 milliseconds, it's mostly associated with increased risk of torsades. Okay. And yeah, I think that concludes this section. So the one thing I want you to pay close attention to is obviously your normal values and how you determine these values, or how you calculate them, or how you measure. And I'd like you to pay attention also to these values, and that is it. And then once you know this, you'll be ready to tackle the next presentation. So I hope you enjoy this, and thank you very much. Yeah, enjoy. So I think I'll post the next session tomorrow. So thank you, guys.